This video is going to be for AMP2 students studying the blood chapter. And this is on platelets and coagulation. In the bone marrow, there are cells which are absolutely huge. Look at that cell compared to some of the ones on the periphery. It is huge. All right, so it can be called a megakaryocyte. Some will call it a metamegakaryocyte. Given that in Latin, mega means big and meta means big, someone is telling you in Latin, this is a really, really big cell. So this is what happens when stem cells are exposed to the hormone thrombopoietin. They then differentiate into these metamegakaryocytes, which are huge, and also, interestingly, then produce all of these chromosomes without dividing. So for example, most cells of your body, they have 2 copies of each chromosome. There are exceptions. Liver cells have 4 very often, but these cells can have 8, 16, 32, 64 copies of each chromosome. The highest in the body per nucleus. And so they then start transcribing all of these genes for specific proteins that they then package into bags. The proteins that they're making are clotting factors. And so then they're making these bags, and the bags, once released, will be called platelets. So platelets then technically are not cells. Instead, they are fragments of an enormous cell. These enormous bone marrow cells, the metamegakaryocytes, split into 1,000, 1,500 pieces. Each of these pieces then is a platelet. And so then platelets leave the bone marrow, go into circulation. Notice that there are some differences in size. You can see the red blood cells here for comparison, because they're fragments of a cell. So some are double the size of others, right? And so very often within the platelets, you can see that they have vesicles of clotting factors. Here's one that's about as large as they're going to get. And as we'll see in the next videos, under certain conditions, they can clump together. There's what's called a platelet plug that normally doesn't happen, but so I'll explain. So when we talked about blood, we said that you could spin it down and make plasma versus the formed elements. And you might have said, well, why not just call them blood cells? Well, that certainly would be easier. But technically, once again, platelets aren't cells. Here we have this giant stem cell in the bone marrow. Under the influence of the hormone thrombopoietin, it then began to produce all of these clotting factors, which are then packaged into vesicles inside platelets. Each metamegakaryocyte can produce, say, between 1,000 and 1,500 platelets. So they're not technically cells. Platelets function in the stoppage of blood, but just this one other process will be mentioned again in a second, so let me just define this as well. Blood vessels have different layers in their walls. So if this is the blood in the middle of a blood vessel, there's the layers of the blood vessel wall. And this then is the muscle layer. So there's smooth muscle in blood vessel walls, and this muscle can constrict. It's called vasoconstriction. And if I were to cut myself, I certainly want to limit blood flow to the wounded area, because the more blood that goes to the wounded area, the more blood that I'll be losing. And so that the smooth muscle then undergoes vasoconstriction. And if we perform vasoconstriction in the blood vessel going to the wounded area, this will limit blood flow to the wound site and thus limit blood loss. So this is what is called a vascular spasm. Vascular spasms can be induced by platelets, as we'll see, but also just a pain response. So if I really hurt this arm, I'll start sending less blood to it. There can be a vascular spasm, which will help to limit blood loss. Okay, so let's now move to the platelets. Now, when I teach, I always tell my students, all right, watch the platelets because they're about to do something exciting. Everyone watches. I'm sorry that Zoom is slowing down the video, and okay. Sorry, that's annoying. Come on. Forgive me, Zoom and the videos are hard to run at the same time. So I tell them, watch the platelets, are going to do something exciting, and they don't. So when they reach, um, when they hit each other, they bounce off. All right. And then when they hit this cell lining the blood vessel wall, which is called the endothelial lining, they bounce off. And so under normal conditions, my students realize I lied to them on the second day of class. They're not very exciting. They bounce off each other. They bounce off the lining of blood vessel walls. But that's what we want. We want that under normal conditions, they don't adhere to each other. We don't want to start clots when we don't need to. It's only then when we've cut ourselves. So if we cut ourselves here, notice that the endothelial cell is gone. Here we've now exposed collagen. Collagen is the most abundant protein in your body. It makes up, so much of connective tissues, not only a quarter of bone and cartilage, but it also is primarily what makes up tendons and ligaments, the dermis of your skin, but in essence, it wraps everything. And so there's collagen virtually everywhere, once again, the most abundant protein in your body. And so if you cut yourself, now these cells may be contacting collagen. While platelets do not stick to each other or to endothelial cell linings, they do stick to collagen. And when they do that, they change their shape. As they change their shape, they kind of reach out and then grab other platelets, inducing them to change their shape. And then this can happen to more and more. And then ultimately then we form what's called a platelet plug. Now, if I cut a major blood vessel, a platelet plug is not going to help because, a big hole with a lot of pressure is just too much. But in smaller blood vessels, this actually would help. If we start to spring a leak, then the fact that now we're plugging that leak helps. Now, one thing that I had left out was that inside a platelet, there are vesicles. Right? So there are bags within platelets. And when the platelet binds collagen, it degranulates. It lets loose these granules. And then it's these granules and their products, which then induce neighboring platelets to then to change their shape, to degranulate and become sticky. And so it was the release of the granules which helps to induce this platelet plug. But that's one of 4 things that the platelet plug, or that the release of the granules will do. So it releases a platelet plug. The second thing is that these chemical signals can be one of the factors helping to induce that vascular spasm. So the smooth muscle of the wall can respond to pain and a neural reflex, but also to these chemicals. And so smooth muscle can now be induced to contract. So the vesicles from platelets can help to limit blood flow to the wounded area by inducing a vascular spasm. Now we have a hole here. And while we have a hole here, we could potentially be losing fluid. But one of the components of this platelet plug is a growth factor. There are different growth factors in the body, like EGF, epidermal growth factor, can induce cell division in epidermal cells. NGF, nerve growth factor, can induce cell division in precursors of nerve cells. And here there is a PDGF, platelet-derived growth factor, which can then increase cell division in the region of a wound and help the tissue repair itself. And so the release of these granules causes the platelet plug, the vascular spasm, the release of growth factors, and then finally, this can help induce the formation of a clot made of fibrin, a fibrin clot, and that's then the most permanent plug of the whole. Now, the formation of clots is complex because there are many steps. It's not as if, we need to form a clot, make this protein, there's the clot. Instead, protein number 1 activates protein number 2, which activates protein number 3, et cetera, in a chain of events, which we call a cascade. There will be 12 different clotting factors and other proteins which are involved as well. So it's a complex process, certainly not occurring in one step. If you're trying to kind of wrap your mind around what's going on, try to imagine a Y, right, where there's the top of the Y with the 2 branches and then the base of the Y. Let's talk about the top of the Y with the 2 branches first. So here's a cell in just the tissues, And if it's, say, damaged, or there's a signal, it can then release signals to neighboring cells that there's a problem here, right? So when there's a problem, our cells don't keep that a secret. They release signals which alert, hey, there's a problem here, set off the alarm. And the tissue factor, which is released from damaged cells around a blood vessel, these then can help to start a clotting factor cascade. So with calcium, which is one of the clotting factors, this can now take inactive clotting factor 10 and activate it. Clotting factor 10 can then activate clotting factor 5, etc. So we can start the clotting factor cascade with tissue cells outside the blood vessel. So this then is known as the extrinsic pathway of coagulation. Also, in addition to this extrinsic pathway, which is started outside the blood vessel, notice that platelets inside a blood vessel could then also induce this as well. So by releasing their granules, platelets then release clotting factors, which can have the same effect. So both of these are ways that clotting can occur. So either from signals outside the blood vessel, like tissue factor in the extrinsic pathway, or by the release of platelet granules inside this. And so once again, these platelet factors, they can then activate one clotting factor, which activates the next, etc. So however this happens, whether it is the extrinsic pathway or intrinsic pathway, remember I said, this could maybe remind you of the letter Y. There are two branches up top, kind of like maybe a goalpost in football. But then there is this bottom portion which always occurs. So whether we start off this way or that way, these last three steps of the common pathway of coagulation will occur, where clotting factors 10 and 5 will activate this enzyme known as prothrombinase, sometimes called prothrombin activator. So the extrinsic and intrinsic pathways activate that step. Prothrombinase turns prothrombin into thrombin, and then thrombin will then take the small little molecules, the monomers of fibrinogen, and then unite them into long chains known as fibrin. If you're wondering how much longer can this go on, the answer is, oh, it just finished. So fibrin is the protein that composes the clot, which will then plug the hole. It is made by proteins which are already present in the blood. So if you remember, when we spin down blood, in the plasma, it's mostly water, but there are also plasma proteins. There are albumins, there are globulins, but then there is also fibrinogen. So fibrinogen makes up 7% of plasma proteins. So the world is a tough place, and therefore you're prepared for it. You're prepared to bleed because you have little pieces of what will make up the clot floating in your blood all the time. And then under the right conditions, then a thrombin will then unite these little molecules of fibrinogen into long chains known as fibrin. Why are they in the blood? Well, the liver puts them there. Now, I always feel a little bad for the liver because very often it's relegated to the digestive system. So when you talk about the digestive system, you talk about the liver and bile. The reality is, however, the liver has more than 200 functions. And with many systems of the body, you could actually, include it. It certainly has some role. So, for example, many of the plasma proteins are made by the liver, and that would certainly include clotting factors. And so the liver certainly has a role in the production of clotting factors. And embryologically, the liver is actually one of the places where blood can be made, including nucleated red blood cells. So we'll get to the liver later, but the liver, certainly deserves more discussion than it probably gets. And so, I tell my students jokingly, it's like, so this is my blood, as you'll see, it's clotting, but proof. I have bled for you. How many of your other teachers could say that? So this is time lapse. And so this is my blood sped up. And what you see then is these dark lines appearing. This is the formation of the fibrin clot. So just as time goes on, you can see, this spidery extension of these proteins. So my blood plasma has fibrinogen in it, the little monomers, and then thrombin starts to then attach one to the next, to the next, to the next. And this then causes, these chains of fibrin, which are not soluble in blood because they're too big. And therefore, this can then plug the hole. Notice that the production of this fibrin clot involved a cascade, multiple clotting factors. Now, other topics, can be then entered in. So, for example, in a clinical sense, this can be bad because while at a wound site, I certainly want my blood to clot. I don't want clots forming inappropriately as they can. If platelets strike uneven surfaces, artificial heart valves, when they die, platelets don't last long. They're just fragments of cells. Or if they hit the uneven surfaces of, say, a lipid plaque in heart disease, especially ones which might actually have collagen exposed. So if plaques get big, this plaque could not only have an uneven surface, which could cause platelets to initiate a clot, it could actually have exposed collagen, which would definitely cause that. Here, you could then start a clot without actually cutting yourselves. Now, that's bad because you're going to have a floating clot, which would then be classified as an embolus, or a stationary clot, a thrombus, and that could then block a blood vessel. So a floating clot might get stuck at a narrowed blood vessel. But because this plaque actually has collagen exposed, you could actually start a clot there, forming a thrombus. And thus in heart disease, when the lumen of our blood vessels narrows because of this lipid plaque, that then is a site where blood flow could be blocked by a clot. If this happens in the brain, we call it a stroke. If this happens in the heart, we call it a myocardial infarction or a heart attack. But this can happen in other tissues as well. Now, if this were to occur in a patient, one can administer what are known as thrombolytic agents. If this clot is a thrombus, a thrombolytic agent can dissolve this. Now, some actually exist in the body. So your body can dissolve clots. Clots aren't meant to last forever. So we can activate an enzyme known as plasmin, which digests the protein of the fibrin clot. And there's certain things which can be injected, say, in the hospital, like streptokinase could do that as well. And so there are thrombolytic agents which can dissolve clots which have already formed. But then there are also what are called anticoagulants. You saw how many clotting factors there are. Some of us, well, we vary. Like when we consider our hair, our noses, our height, etc., there are different forms. And when it comes to clotting factors, some of us make more than others. And so you could test your blood and ask, why has this patient had a couple of strokes or heart attacks? You might say, wow, they have, a higher than normal level of clotting factors in their blood. Their blood clots faster than normal. There are chemicals that you can then take, anticoagulants, which then reduce the level of clotting factors, sometimes called blood thinners. So now your blood would be less likely to clot because there's a lower level of clotting factors in it as a rule. And so just last point is that you saw how many different clotting factors there were. We numbered them, there are 12 clotting factors, and then there's many other related proteins. With all genes, there are individuals where the gene has a mutation and it doesn't make as much protein as it should. It doesn't make a functional protein, so sometimes there's a sort of a mutation. And so therefore, there are a number of different bleeding disorders where someone has a mutation in making something of the clotting factors, and blood clotting does not occur as it should. Several of these we lump together and we call hemophilia. Some of those forms are sex-linked, so more common in males, but because there are a large number of proteins involved here, there's a number of bleeding disorders.